Today on Some Assembly Required, we'll be discussing the transportation budget and welcome Representative Deb Kolste to the show to share her thoughts on transportation, the Assembly Task Force on Suicide, and a number of other health-related issues. This is Some Assembly Required, a podcast hosted by the Wisconsin Assembly Democratic Caucus discussing what's happening in the state capitol and all things Wisconsin. I'm your host, Assembly Democratic Leader Gordon Hintz, representing the 54th Assembly District and the city of Oshkosh. Heading into the budget, addressing a long-term transportation funding solution was probably the biggest challenge facing the state of Wisconsin. With Wisconsin roads ranking as some of the worst in the nation, it was important that the legislature act urgently. The governor put forward a plan that invested in roads by significantly reducing bonding and coming up with that sustainable revenue source. You know, the budget didn't end up there, but the reality was $6.5 billion of investment in the governor's budget to transportation included more ongoing revenue than ever before, while reducing the amount of bonding for highway purposes in the last 2 decades. The budget passed invests $320 million in the next budget for state highway rehabilitation programs. It makes overdue investments in local roads by increasing general transportation aids to local government, and it increased investments in transit, including general transit aids and senior and disability specialized transportation aids. So the good news is there was new money in the budget. The bad news is that Republicans in their budget chose to pay for highway infrastructure with increased fees only on Wisconsin drivers. The budget chose these fees in addition to rating general fund revenue that should be used for public schools and universities. Vehicle title fees were increased by $95, and annual automobile registration fees were raised from $75 to $85. Now, this is inequitable in 2 ways. First, it charges my mom, who drives 500 miles per year in Oshkosh, the same as me, who drives around 30,000 miles a year, including between Oshkosh and Madison. And secondly, the fees assessed to Wisconsin drivers fail to account for drivers from other states using our roads. So drivers from Minnesota or Illinois who use our roads get away without paying their fair share and leave Wisconsinites to foot the bill with fee increases. Now, the rest of the new funding came from taking $177 million from the general fund, including one-time money from the existing fund balance in order to fund local roads. The challenge facing the state wasn't just finding new revenue for roads, it was about finding sustainable funding. And by rating the general fund, it means the state is going to be back in the same position in the next budget, searching for long-term sustainable transportation funding. And now I would like to transition and welcome our guest, Representative Deb Kolste, who is in her 4th term representing the 44th Assembly District and the city of Janesville. She's the ranking member in the Assembly on the Transportation Committee, Health Committee, and the Substance Abuse Committee. Welcome, Representative Kolste.
Well, thank you, Representative Hintz. I appreciate being here.
Hey, it's great to have you. I know you've been hearing a lot about the show, and you said you really wanted to be on.
And I am going to listen to it this time.
Well, we think that having you on is really going to take us to the next level. So we're excited about that.
And I love the wish list that could have been that you read off on transportation, and as opposed to what we got from transportation in the actual budget that was passed.
So having it's your 4th term, and it's kind of covers the period of time that we've really been toiling. I mean, what are your thoughts on transportation, why the state hasn't acted, and, what do you think the most important thing for listeners out there is to know about, our transportation dilemma in Wisconsin?
Probably the most important thing is what you said, it's not sustainable. So ever since I've been in the legislature, I've been on the Transportation Committee because it was vital to Janesville to get the I-39 corridor fixed. But they've always been looking for new ways. They've had several study committees. I remember my first year in, they had this very glossy production of what we should do for to make it sustainable in our transportation budget, and we didn't talk about anything that entire 2 years. We did another study session, and Gottlieb went around the state and talked about what we needed for transportation budget and what had got him misfired. So we've been talking about it for a long time, and we'll still be talking about it because we've not done anything concrete. We need a system to generate revenues that will fix the roads and improve our transportation needs, and not just the highways, but all types of modal transportation.
What do you think? I mean, what do you think the biggest obstacle? What do you think is, why didn't we do anything for 8 years? And is it just a matter of political will?
Obviously, Governor Walker said that all the time, that he was not going to institute any new taxes, and therefore we didn't do anything. And now it's cost us more every year that goes by that we don't fix something. It costs not only more to fix it, but it has cost the consumer in having their cars fixed or delays in transportation. So there's been a personal cost as well as a cost to the state not getting these things fixed.
Okay, well, let's pivot to some of the other work that you're doing right now. You currently serve on the Assembly Task Force on Suicide Prevention. Yesterday you were in Eau Claire for a public hearing. What's happening so far with what you've heard around the state? What kind of things are you talking about? What are you hearing from people? And are there things that state government can do to ultimately reduce suicide among our population?
Well, this is probably the biggest thing we can do, and the biggest thing we hear about is we need more mental health. The ACA, for whatever flaws somebody may say it has been a benefit, for most importantly because it gave parity between mental health and physical health. But our funding hasn't kept up between mental health and physical health. So I think we heard over and over and over again how we need more dollars put towards mental health, and these are complicated things to talk about, and it's always emotional. But we also need to talk about the mechanisms that people can complete a suicide. And we hear over and over and over again that firearms are the number one way that people complete a suicide. So I think we need to take a look at that, and I'm not sure that there's the will on our task force to look at that. We talked with law enforcement yesterday and military, and once again, they're instituting their own programs to lock up firearms if they deem that somebody is in a bad state or having problems. So they're doing things on their own. And I think what the military does and law enforcement does, we should be able to do as a state. It's time that we have a conversation about firearms. And, when we started talking about opiate abuse, people were killing themselves with overdoses, and we did not have a problem at all providing Narcan, an immediate fix to an immediate problem, trying to save a life. So we know right now how we could save lives, and that's by decreasing the amount of firearms. 48-hour wait period. Certainly, if somebody is struggling with mental health illness, there's a way to stop maybe an immediate action. If somebody else is in a mental health crisis, making sure that they can't, red flag laws that make sure that they can't have a weapon at hand. So there are things we could do, just like we use Narcan for an immediate solution to an immediate problem. There are things we can do. And I hope that this legislature has the wherewithal to talk about those, because they come up again and again during the committee hearings.
I think that's a really good point. Obviously, a large component of this is, awareness, recognizing, intervening when you can with people with mental health challenges, but making it more difficult for someone who's under duress to prevent them from harming themselves or harming for others seems to be an important part of the narrative right now in terms of if we're going to, whether we're talking about suicide prevention or mass gun violence prevention. And I think you really, really did a good job summarizing that. Pivoting just to, a little bit about you. One of the things we like to do on Some Assembly Required is give a little bit of, get to know our members. Can you remember the exact moment you decided to run for state assembly?
Yes, it was at the YMCA when I was talking to someone who had been on the school board with me who had worked in the Capitol, and he said, you ought to run for assembly. And I suggested that he run for assembly, and he was the last person to say, I think you should run for assembly. So I did, and he became my staff person. And tell us a little bit about the district that you represent. Well, it's Janesville. It's not all of Janesville, but nothing. Janesville is my district. It's, a hardworking community. It went through a lot of problems when GM shut the plant and pulled up their stakes. We've had a lot of other economic developments since then. So we are thriving. It's a great place to live. I was on school board for 9 years, and I enjoy being in the community. We offer a lot. I think, sure, I would be happy wherever we landed, but I'm very glad we landed in Janesville.
What's your favorite part of the job, and what's your least favorite part of the job?
Politics is my least favorite part of the job, and I will never understand that. And
It took you so long to give us that answer.
Because I just stated it about 5 minutes ago in another meeting. And my favorite part of the job is the opportunity to learn. They give such wonderful programs in this building, especially on healthcare, evidence-based public policy, and UW Health, and the things that I've learned that I may not ever get to use in bills sitting in the minority, but it's still just, it's so valuable to be able to have that knowledge, and I just love learning. So, and of course, having the minority leader, Gordon Hintz, is probably second.
That's a common answer, maybe? I appreciate that. You've always been involved in other healthcare reform legislation. What other things are you working on? What are your goals for the rest of this session?
So the PBM bill is the most important thing.
I'm sorry, PBM?
Pharmacy benefit managers. They're the ones who tell you what you will pay, what will be on your formulary, where you can get, which pharmacies you can go to. They direct your pharmaceutical life, and they're very not transparent. So it's probably the most important bill I've worked on. When I started this 3 years ago, somebody graciously gave me a hearing, and I think it changed the attitudes of the majority party, and now it is a very bipartisan bill that has over 90 co-sponsors. So you would think we'd get a hearing with that amount of co-sponsors. But anyway, it's very important to the consumer and to local independent pharmacies that this passed. So I'm working really hard on that one. We're also put out the vaping bill, Indoor Clean Air Act, so that you wouldn't be allowed to vape in the same places you wouldn't be allowed to smoke a cigarette. So I think that's important. And just recently we were hearing all those stories about children that had been hospitalized with respiratory distress. So that's another one I'm working on. These are all going to sound like I'm working on medical bills. Telehealth, which would be allowed payment from Medicaid for telehealth services the same as they would be paid if they were provided in the office under regulations. And another one that's important to the consumer is a surprise billing bill. It just says if you go into a hospital and it's a part of your network through your insurance, that somehow you need to be aware that they have providers that may not be in your network and that they might cost more. So there would be negotiation on how you would translate that into actually how much you're going to pay. So anyway, surprise billing has been important in the United States, and it's getting a lot more talk and movement on how we can resolve those concerns.
So, I mean, each of these bills seems about, are not the massive healthcare discussion about that we all have related to the budget or the Affordable Care Act, but really things that can make a big difference in terms of transparency, quality of care, affordability. I know that when I heard about the pharmacy benefit manager, it's one of these complicated things that I think the public may not understand, but they would be outraged by if they knew that there was a middleman whose incentives were sort of purely to make as much money as possible at the expense of the consumer, who kind of gets wrapped up in the lack of disclosure in the insurance process, right?
And that's my concern, is all these, when you talk about transparency, that's the missing item in healthcare costs. And there's just so much money in healthcare that at any given moment, somebody that works in healthcare is figuring out a different schematic to make money that doesn't change the outcomes for patients. And I think that's the biggest concern, is that what we do should affect the outcome of patients and make them healthier, and we don't do that right now.
Okay, well, a lot of good things. Look forward to seeing, hopefully we'll get some of those things done the rest of the session. Well, now it's time on Some Assembly Required for what we call the speed round. It's everybody's favorite part of the show.
Are you sure?
It is. Are
Okay.
you ready?
I don't know.
When we have a late night session, what's your comfort food? What do you go to? What do you order?
Chicken noodle soup.
From? You bring a thermos.
No, noodles.
Oh, from Noodles and Company. Okay. What is your Starbucks order?
Small skim dry cappuccino.
What's your favorite city in Wisconsin besides Oshkosh and Janesville?
Madison.
Sweet corn or popcorn?
Popcorn.
The State Fair or Summerfest?
State Fair.
Trek or Cannondale?
Trek.
The Summer Olympics or the Winter Olympics?
Winter.
Kansas City or Omaha?
Omaha.
Donuts or bagels?
Bagels.
Notting Hill or Pretty Woman?
Ooh. Notting Hill.
Taco Bell or Taco John's?
I can't say neither.
No, you've got to choose one. What logo do you like better?
Okay,
Or
Taco John's.
Who do you worry about more if they eat a lot of it?
Taco John's potato lays.
Do you like sweet food or salty food?
Salty.
Cattle farming or crop farming?
Crop.
The Beatles or the Rolling Stones?
Beatles.
Beatles or Led Zeppelin?
Beatles.
Beatles or Elvis?
Elvis in movie, Beatles and music.
I'm going to let you get away with that. Barbecue or fish fry?
Ooh, fish fry.
Cheddar or Swiss?
Cheddar.
Paul Ryan or Newt Gingrich?
Well, Paul Ryan.
Come on.
He's from Janesville.
Cheetos or potato chips? Did I ask you that one?
Both.
That is all I had. I want to thank you for being on Some Assembly Required. This is number 4. You look forward to the first 3 you can get on Apple Podcasts under Some Assembly Required. And we look forward to on number 5 coming up. I want to thank you, Representative Deb Kolste, for joining me today.
Well, thank you, Representative Gordon Hintz.
And I want to thank Dave Groshek, assistant to the producer, for production on today's show. And we'll see everybody next time.